Introduction. Carvedilol is a non-selective beta-adrenergic receptor blocker, B1 and B2, and an alpha-1 adrenergic receptor blocker, used primarily for hypertension, high blood pressure, heart failure, mild to severe, left ventricular dysfunction after a heart attack, belongs to the adrenergic antagonist class. Available in tablet and extended-release capsule forms. Mechanism of action. Beta-adrenergic blockade, B1 and B2 receptors. Reduces heart rate and cardiac output, lowering the workload on the heart. Decreases sympathetic nervous system stimulation in the heart. Alpha-1 adrenergic blockade. Dilates blood vessels, reducing peripheral vascular resistance and blood pressure. Dual action. Prevents reflex tachycardia, commonly seen with pure vasodilators. Antioxidant properties. Protects the heart and blood vessels from free radical damage, which may help in managing heart failure. Side effects. Cardiovascular, bradycardia, slow heart rate. Hypotension, low blood pressure. Dizziness and fatigue due to reduced blood pressure. Respiratory, can worsen bronchospasm in patients with COPD or asthma. Gastrointestinal, nausea, vomiting, and diarrhea. Central nervous system, headache and drowsiness. Other, cold extremities due to reduced blood flow to hands and feet. Weight gain in some heart failure patients. Contraindications. Absolute contraindications. Asthma or severe chronic obstructive pulmonary disease, COPD. Risk of bronchospasm. Severe bradycardia, heart rate, 50 beats, min. Heart block, second or third degree without a pacemaker. Cardiogenic shock, severe failure of the heart to pump blood. Decompensated heart failure requiring intravenous inotropes. Relative contraindications. Diabetes. May mask symptoms of hypoglycemia, for example, rapid heartbeat. Peripheral vascular disease. Can worsen due to reduced blood flow. Liver impairment. Carvedilol is extensively metabolized in the liver. Pregnancy and breastfeeding. Use cautiously as safety data is limited. Maximum daily dose, hypertension. Maximum daily dose, 50 mg. Divided doses of 25 mg twice daily. Heart failure. Maximum daily dose, 50 mg. For patients weighing 85 kilograms. For patients, Air 85 kg, 25 mg twice daily. Left ventricular dysfunction, post-myocardial infarction. Maximum daily dose, 50 mg. Divided doses. Extended release capsules may have different dosing regimens. Most popular international brands containing Carvedilol Coreg. Manufacturer, GlaxoSmithKline, USA. Dilatrend, manufacturer, Roche, Switzerland. Carvil, manufacturer, Novartis, Germany. Credex, manufacturer, Servier, France. Cardiol, manufacturer, Abbott, India. Many generic versions are available globally. Adverse events, general adverse events, dizziness and fatigue, common due to blood pressure reduction. Bradycardia, slow heart rate. Hypotension, especially in heart failure patients. Nausea, diarrhea, and occasional vomiting. Food-related adverse events. Taking Carvedilol with food helps reduce the risk of orthostatic hypotension, drop in blood pressure upon standing. Empty stomach may lead to rapid absorption, causing stronger initial blood pressure lowering effects. Specific foods, avoid alcohol as it can enhance the blood pressure lowering effect. Other notable adverse events, cold extremities, due to reduced blood flow. Respiratory difficulties in asthma, COPD patients. Headache and drowsiness. Drug interactions with beta blockers or calcium channel blockers, for example, verapamil, diltiazem. Risk of excessive bradycardia or heart block with digoxin can increase digoxin levels, leading to toxicity. With insulin or oral hypoglycemic drugs, may mask symptoms of hypoglycemia like rapid heartbeat. With NSAIDs, for example, ibuprofen, may reduce Carvedilol's blood pressure lowering effect. With CYP2D6 inhibitors, for example, fluoxetine, quinidine, increases Carvedilol levels, leading to enhanced effects. With clonidine, withdrawal of clonidine while on Carvedilol may cause a dangerous spike in blood pressure. Food interactions with food. Taking Carvedilol with food can help prevent sudden drops in blood pressure, orthostatic hypotension, making it easier on the body. Empty stomach. Taking Carvedilol on an empty stomach might result in faster absorption, but can cause a more pronounced initial decrease in blood pressure. Alcohol. Avoid alcohol while on Carvedilol. Alcohol can enhance the blood pressure lowering effect and increase the risk of side effects like dizziness and fainting. Food containing high sodium. Foods high in sodium may reduce carvedilol's blood pressure lowering effect, as high sodium intake can raise blood pressure. Pharmacology class. Carvedilol is a beta blocker with additional alpha-1 blocking properties. Action: reduces heart rate, contractility, and blood pressure by blocking beta receptors, B1, B2, and alpha-1 receptors. It also has antioxidant and anti-inflammatory effects. Absorption. Carvedilol is well absorbed after oral administration, but undergoes substantial first-pass metabolism in the liver, reducing bioavailability to 25 to 35%. Metabolism. Metabolized primarily in the liver by CYP2D6 and CYP2C9 enzymes. Excretion. Excreted mainly in the urine, about 60%, with a smaller amount in feces. Pharmacodynamics. Mechanism. Beta-adrenergic blockade, B1 and B2. Reduces sympathetic nervous system effects on the heart, leading to lower heart rate and decreased myocardial oxygen demand. Alpha-1 receptor blockade. Causes vasodilation, lowering peripheral vascular resistance, which reduces blood pressure. No reflex tachycardia. Unlike some other blood pressure medications, carvedilol does not cause an increase in heart rate despite lowering blood pressure. Beta-1, B1. Blockade. This leads to decreased heart rate and contractility, which is beneficial for conditions like hypertension and heart failure. Beta-2, B2. Blockade may cause bronchoconstriction, which can worsen asthma or COPD in some patients. Alpha-1, A1, blockade reduces vasoconstriction, which leads to lower blood pressure and reduced afterload in heart failure. Antioxidant effects. Carvedilol has antioxidant properties that may help protect blood vessels and heart tissue from oxidative damage. Pharmacokinetics. Absorption. Carvedilol is well absorbed after oral administration, but has a low bioavailability due to extensive first-pass metabolism. Peak plasma concentration occurs in 1-2 hours after taking the medication. Distribution. Widely distributed throughout the body. Plasma protein binding. Carvedilol is 98% bound to plasma proteins. Metabolism. Carvedilol undergoes extensive metabolism in the liver, primarily by the enzymes CYP2D6 and CYP2C9. Half-life. The half-life of carvedilol is 7-10 hours, which allows for twice-daily dosing. Excretion. Primarily excreted through the urine, about 60%, and feces, about 40%. Only a small amount of unchanged carvedilol is excreted in the urine. Chemistry of carvedilol chemical formula, C21H24N203. Molar mass, 362.43 g per mole. Half-life, 7-10 hours, elimination half-life. Melting point, approximately 114 degrees to 118 degrees. Solubility, moderately soluble in water, more soluble in alcohol and methanol. Organic molecule class, beta blocker and alpha blocker. Phenylpropanolamine derivative. Amine group attached to a phenolic structure. Bioavailability, 25 to 35% after oral administration, due to first-pass metabolism in the liver. References book. Title: Pharmacology of Carvedilol and its effects on cardiovascular health. Country: USA. Date: 2020. Study findings: Carvedilol is effective in lowering blood pressure and improving heart failure symptoms by blocking B-adrenergic and A-adrenergic receptors. Website: Source: PubChem, National Center for Biotechnology Information. Country: USA. Date: 2023. Study findings: detailed pharmacokinetic profile and molecular structure of carvedilol, showing its solubility and binding properties. Study. Title: Carvedilol's Efficacy in Hypertension and Heart Failure. Country: UK. Date: 2021. Study findings: investigated the clinical effectiveness of carvedilol in managing hypertension, revealing its dual action as a B1, B2 blocker and A1 blocker. Website: Source: drugs.com. Country: USA. Date: 2024. Study findings: overview of carvedilol's chemistry, pharmacodynamics, and approved uses in treating heart failure and hypertension. Book. Title: Clinical Pharmacokinetics of Carvedilol in Heart Disease Treatment. Country: Canada. Date: 2019. Study findings: comprehensive review of carvedilol's pharmacokinetics, emphasizing its bioavailability and metabolism by liver enzymes.